Hi, this is Caitlin. I'm the Director of Social Services at Derby Health and Rehab. Today I will be doing a presentation on abuse, neglect, exploitation, and also resident rights. So first, let's start with what is abuse. Abuse is any act or failure to act that intentionally results in or might result in physical, mental, or psychological harm to an elder. Neglect is defined as the failure to provide needed goods, care, or services that are reasonably necessary to ensure the safety and well-being of an elder. It is also to be noted that neglect can be performed by oneself, failure to take care of themselves, or of a caretaker taking care of the elderly and them neglecting to provide the needed goods, care, or services as well. Exploitation is defined as misuse of elder property or intentionally taking unfair advantage of an elder's physical or financial resources for personal gain. This can be done by using coercion, harassment, deception, or false representation by a caretaker or even a resident's family member. All facility employees are mandated reporters. It is important that you report all alleged or suspected instances of abuse, neglect, exploitation, and report it to the administrator, director of nursing, or director of social services. Derby Health and Rehab's social media and other web-based communication policy states, unless approved by this facility or parent organization, no employees are permitted during working hours to use social media, speak on behalf of the facility, or publicly discuss work-related matters outside facility-authorized communications. Employees are expected to protect the privacy of the facility, its residents, and fellow employees. Employees are cautioned that they should have no expectation of privacy while using the internet. Postings can be reviewed by anyone, including management and staff of the facility. Now to discuss resident rights. Residents each have 8 basic rights: the right to be fully informed, the right to complain, the right to participate in their own care, right to privacy and confidentiality, rights to transfer and discharges from the facility, right to dignity and respect, the right to have visitors, and make independent choices about their care. Residents each have the right to be fully informed of their care, such as available services, facility rules, and be informed of any change in care they may experience during their stay, and the right to receive information in a language that they understand. Residents have the right to voice their concerns or complaints and have those concerns followed up on in a timely manner without retaliation. Complaints can be addressed within the building, but the residents also have the right to voice their concerns to the state ombudsman or the state survey agency. If a resident voices a complaint about their care, please notify your charge nurse immediately and also notify the director of social services. If a complaint form needs to be filled out, they are located in bright yellow folders in the social services mailbox located between houses 1 and 2 and houses 3 and 4. There is also comment cards located next to each of the exit doors in each house. It's to be noted that residents also have the right to voice complaints anonymously. If they are hesitant to have a complaint followed up on, please educate them that they are allowed to report anonymously and still have their concern followed up on. Each resident has the right to participate in their own care and make their own decisions about their care. They have the right to refuse any care they do not wish to receive, such as medications or treatments. They also have the right to review their own medical records should they choose to do so. Residents have the right to privacy and confidentiality. This includes being able to have private conversations as they see fit. They also have the right to privacy during treatment. This can mean having their vitals taken in a private area or requesting that their insulin be given in the privacy of their own room. Residents each have the right to transfer or discharge from a facility per their choice. Each resident has the right to advance notice of the discharge, including the effective date, the reason, and the right to appeal. Residents also have the right to a safe transfer or discharge, which includes adequate planning from the nursing facility. Residents have the right to be treated with consideration, respect, and have freedom of choice. Examples of this includes them being free from mental or physical abuse, having the right to have showers or baths when they prefer, either in the morning or the evening, or if they say they prefer not to be called by terms of endearment such as honey or dear. Residents have the right to have visitors, which may include family, friends, or other medical professionals. They also have the right to refuse visitors if they do not wish to see anybody. Residents have the right to make their own decisions about their care. This may include what to wear or how they choose to spend their time. It can also include their choice of physician or how they want to manage their financial affairs. The Kansas Long-Term Care Ombudsman is a service in place to help advocate for residents who live in long-term care facilities. The program is designed to advocate for the rights of the resident and give a voice to those who may not otherwise be heard. Marilyn Randa is the long-term care ombudsman for our region. Her contact information is below and can also be provided to any resident in need of these services. The true test of a man's character is what he does when no one is watching. John Wooden. Thank you for watching this presentation, and if you have any additional questions, please reach out to Caitlin Blankenship, Director of Social Services at Derby Health and Rehab. Thank you.